Most of the kidney patients early on are asymptomatic, and a part of it is your body try to compensate as much as it can. Some of the subtle changes, complications of kidney disease can be noticed by a physician or a kidney specialist. Those are the blood test and the urine test. You can see the blood pressure going high. As a blood test we do, we can find how much kidney function it is, but also people will have a problem with their potassium, the phosphorus. You can build up more and more acid. We could do some of the tests which shows us that as the kidney disease advances, the bones become more and more brittle, and you need to take care of that as well.
Oh, I didn't feel no different. I felt fine. I didn't know. As you go along, you learn more about it. A couple of years ago, Dr. Bearware sent me to a nutritionist, kidney, and it really helped me because she told me what foods I could eat, how many I could eat.
There are kidney disease which can be treated. If it's because of hypertension, because of diabetes, the main thing will be to control those two problems. There are kidney disease which can be stopped, but those are not very common. If it has happened because of obstruction, you can relieve the obstruction. If it's because of the medications, you can relieve that. For blood pressure and diabetes, if you actually control those, yes, the kidney, it might not reverse back, but it does decrease the progression. With medications, I said, we can decrease the protein in the urine, and further down, it can avoid having more and more damage to the kidney.
I'm dieting, I'm eating properly and stuff like that. And I just saw a list in the room while I was waiting on you. Talked about foods you should avoid and not eat. And I read it and looked over, and of course you can't hardly eat anything, but that's the life we live. The nutritionist helped me by telling me you cannot eat this amount. You can have a quarter chicken, for instance. She said, but you can't have a quarter chicken all at one time. You got to eat half and then wait a couple more hours and eat the other half. And have to stay away from different foods. Anything got salt, flour, sugar, those things you stay away. Things that are high in grease, type of things. Finding out how much it affects and how treating one thing can hurt the kidneys.
It's important to know what your kidney disease is from, what is your kidney function, and what you can do to avoid it, what you can do to treat it, what you can do to avoid the complications of it, and prepare in timely fashion for dialysis.
Dr. Bearware has been real great. She's really trying to keep me out of dialysis. I don't want dialysis. I don't want to be in dialysis. It's not that I don't want dialysis. I don't want to need dialysis. Let me say it that way.
I think there is a social fear about dialysis, and I don't blame the patients for that too. It's difficult because it's a big step in your quality of life. It's going to deteriorate with the dialysis. But it's very important for you to know what dialysis means. Most of these patients who come to our kidney doctors in appropriate time as the kidney function goes down, we do send them to the different classes. It's called as a dialysis option class, and we ask them to go and find out what is going to be happening when they are on dialysis. What are they expected to do? Because there are different modalities of dialysis too. They need to know that. So something I call to my patients, hey, you need a physical and a mental preparation for a dialysis.